Hi, how are you today?
I'm good, how are you?
Good. My name is Ann Hayward. I'm a physical therapist assistant student. And I'm just here. I'm going to work with you today. Is that okay with you if I work with you?
Yeah.
Okay, awesome. So my job as a physical therapist assistant student, I'm going to help the physical therapist carry out his, kind of the program that he set up for you to help you with some things. I see here that we're seeing you for some back pain, is that correct?
Yeah, that's right.
Okay, awesome. And before we get started, can I have you verify your name and your date of birth?
It's Clayton Kershaw, 7/31/88.
Okay, awesome. Got the right patient. Okay, perfect. So, like I said, it sounds like we're seeing you for your back.
Right.
How bad is your pain today on a 1 to 10 scale? 1 being like little to no pain, 10 being like excruciating pain?
About a 6.
About a 6, okay. So a little bit of pain. What increases that pain throughout the day?
Lifting stuff.
Lifting stuff, okay.
Yeah.
Is there anything that helps relieve the pain, make it feel better?
Not doing those activities.
Okay, yeah, that makes sense. Okay, so I know your pain is a little bit up there. Are you okay if I show you maybe some lifting techniques today to help out? Do you feel like your pain, that would be okay?
Yeah, it'll be alright.
Okay, awesome. One of the techniques that I'm going to show you today is called the golfer's lift. So this is for like lightweight objects or small objects that you can pick up just off the floor. But first, before we do that, I'm going to talk to you about keeping your spine straight and your pelvis neutral, okay? So what I want you to do is I want you to feel on your hip bones right here. Awesome. Okay, and then feel back here on your hip. Wonderful. Okay, so what we're going to try and do is I'm going to have you like kind of stick out your chest and your stomach, okay, and feel how your pelvis rotates that way.
Right.
Okay, and then kind of scrunch your stomach in and kind of curve your back, okay, and feel how it rotates that way.
Mm-hmm.
Alright, so these are different rotations, okay, but we want to stay right in the middle of that, okay, so you can kind of feel where your spine feels neutral, or your pelvis feels neutral in between those two tilts, okay, so that's your home base, that's where we want you to stay, okay. So while you're doing the activities, we want your core to be tight, okay, back straight, and that pelvis neutral. So I want you to keep that in mind. So I'll have you stand up, and I'll show you this exercise. Okay, so pretend that there's something that's on the ground, alright? And, let's see, where's my little handout? Okay. Awesome. So there's something on the ground. Here it kind of shows like it might be by like doing laundry or something that's fallen on the ground. So you need something that you can stabilize if you don't have a lot of balance. So here it looks like they're using like the washer dryer. Here we'll just use the table. So what you're going to do is you're going to put one hand on the object to steady yourself. You're going to shift your weight to one foot, and the whole time trying to keep your spine straight, because when we bend over, we want you to keep your spine straight, and then when you bend forward, keep it parallel to the ground. And while you're bending, we want you to lift the other leg. It kind of counterbalances that weight so it can keep you steady and balanced.
Okay.
And then you just pick it up and come back right up to the upright position. So I'll demonstrate that for you. Again, we're going to be holding onto a steady object. Shift your weight onto one leg, okay? Bend down, lifting up the other leg, keeping your spine parallel, okay? And then come back up. And then you just set it down just the same way. And this will help, like you said, because you're having a lot of back pain. Oftentimes people bend over, twist and turn and do things and don't keep that spine straight, and it can cause back pain, it can cause injury. So what we're trying to do is teach you some techniques so that we can help prevent the further injury and also to help continue to get you better.
Okay.
Alright, so do you have any questions?
No, pretty clear.
Okay, awesome. Okay, do you want to repeat back to me what you will be doing and then demonstrate?
Okay, so I'm going to approach the objects
Okay.
and find something to stabilize myself.
Okay.
And put my weight on the inside leg, right?
Uh-huh.
And then from there, I bend at the torso, keeping my body straight,
Uh-huh, yep.
parallel to the floor.
Uh-huh.
Okay. And then I just reach down and grab it with this leg coming up.
Uh-huh.
Okay.
Yep, just like that. Perfect. You've been awesome. And then do you remember how you set it down?
Same way I picked it up.
Uh-huh. Good. Awesome. Okay, so here's that. I printed that out for you. You can take that home. And then you can remember this like as you're doing your like activities and stuff throughout the day. Then you can remember to use this to pick up objects. Do you have any further questions?
No. That's great.
Okay, awesome.
Thank you.